CEN Written Exams Tips. Question 1. A patient has a cut from a knife that is 2 cm deep and located on the palm of the hand. The CEN should: Option A. Irrigate and suture the wound. Option B. Check for tendon and nerve function. Option C. Apply a pressure bandage. Option D. Administer antibiotics. The correct answer is option B. Check for tendon and nerve function. Deep lacerations on the palm are at high risk for tendon or nerve injury. A thorough neurological and functional assessment is essential to identify any deficits. The wound should be irrigated and may be sutured, but only after the assessment. Antibiotics are not routinely given for wounds unless infected or high-risk animal bites. Pressure bandages are for bleeding control. Question 2. A patient with anaphylaxis presents with stridor, hypotension, and respiratory distress. The CEN should: Option A. Administer epinephrine IM. Option B. Administer epinephrine 4. Option C. Administer albuterol nebulizer. Option D. Administer diphenhydramine 4. The correct answer is option B. Administer epinephrine 4. IM epinephrine is first line for anaphylaxis, but in severe cases with hypotension and stridor, airway compromise, 4-epinephrine may be needed. 4-epinephrine is a more potent vasoconstrictor and inotrope, reserved for severe presentations. Albuterol and diphenhydramine are adjuncts, not primary. Question 3. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as: Option A. Mild exacerbation. Option B. Moderate exacerbation. Option C. Severe exacerbation. Option D. Life-threatening asthma with impending respiratory failure. The correct answer is option C. Severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 4. Which of the following is a classic finding in a patient with pericarditis? Option A. ST segment elevation in all leads. Option B. PR segment depression. Option C. Chest pain that worsens with inspiration. Option D. All of the above. The correct answer is option D. All of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 5. A patient presents with severe crushing chest pain. The ECG shows ST segment depression and T-wave inversion in leads 2, 3, and AVF. This is most consistent with: Option A. Anterolateral STEMI. Option B. Inferior STEMI. Option C. Non-ST elevation myocardial infarction, NSTEMI. Option D. Pericarditis. The correct answer is option C. Non-ST elevation myocardial infarction, NSTEMI. ST segment depression and T-wave inversion without ST elevation indicate NSTEMI, or unstable angina. Inferior leads, 2, 3, AVF, show ischemic changes. NSTEMI management includes antiplatelet therapy, aspirin, ticagrelor, anticoagulation, and possible PCI depending on risk stratification, Grace score. STEMI requires emergent reperfusion, while NSTEMI is managed with a more nuanced approach. Question 6. A patient with a pulmonary embolus is receiving heparin. The CEN should monitor for which complication? Option A, bleeding. Option B, heparin-induced thrombocytopenia, HIT. Option C, allergic reaction. Option D, all of the above. The correct answer is option D, all of the above. Heparin has multiple complications: bleeding, due to anticoagulation, HIT, immune-mediated thrombocytopenia, and allergic reactions. Monitoring includes APTT, for therapeutic effect, platelet count, for HIT, and bleeding assessments. HIT should be suspected if the platelet count drops significantly. Alternatives include direct thrombin inhibitors, argatroban, if HIT occurs. Question 7. A patient has a smoke inhalation injury. Which finding should raise concern for carbon monoxide poisoning? Option A, cherry red skin color. Option B, headache, confusion, nausea. Option C, SpO2 95% with significant distress. Option D, all of the above. The correct answer is option D, all of the above. Carbon monoxide, CO, poisoning causes headache, confusion, nausea, and, later, cherry red skin color. Pulse oximetry, SpO2, may be falsely normal because it cannot distinguish between oxyhemoglobin and carboxyhemoglobin. Treatment includes 100% oxygen, non-rebreather mask, and possibly hyperbaric oxygen therapy for severe cases. CO levels should be measured by CO oximetry. Question 8. A patient with acute stroke has aphasia. The CEN should: Option A, speak loudly and slowly. Option B, use simple, short sentences and allow time for response. Option C, avoid speaking to prevent frustration. Option D, write everything down. The correct answer is option B. Use simple, short sentences and allow time for response. Aphasia, language impairment, often expressive or receptive, in stroke patients requires patience and clear, simple communication. Speaking slowly and using short sentences reduces cognitive load. Speaking loudly is not helpful as aphasia is not a hearing problem. Avoidance limits communication. Writing may help some patients but should be combined with verbal cues. Speech therapy consultation is appropriate. Question 9. What is the primary mechanism of injury in a patient with a flail chest? Option A, penetrating trauma to the chest. Option B, blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Option C, sudden deceleration injury. Option D, compression injury causing rupture of the diaphragm. The correct answer is option B. Blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely mobile segment. This paradoxical movement impairs ventilation and may lead to respiratory failure. The underlying pulmonary contusion is often the main cause of hypoxia. Treatment includes pain control, oxygen, and possible mechanical ventilation. Question 10. A patient presents with a severe headache, nausea, and vomiting. The patient has a history of hypertension. Which finding would suggest a subarachnoid hemorrhage? Option A. A sudden, severe headache, thunderclap, and nuchal rigidity. Option B, gradual onset headache. Option C, blurred vision and photophobia. Option D, focal neurological deficits. The correct answer is option A. A sudden, severe headache, thunderclap, and nuchal rigidity. Subarachnoid hemorrhage presents with a sudden, severe thunderclap headache, often described as the worst headache of my life. Nuchal rigidity, neck stiffness, is a classic finding. CT head is the initial diagnostic test. Gradual onset suggests a different etiology, e.g., migraine. Focal deficits may suggest an ischemic stroke or mass lesion. Question 11. A patient is 32 weeks pregnant and presents with vaginal bleeding, abdominal pain, and contractions. The CEN should suspect. Option A, placenta previa. Option B, abruptio placentae. Option C, ectopic pregnancy. Option D, normal labor. The correct answer is option B, abruptio placentae. Abruptio placentae, placental abruption, is the premature separation of the placenta from the uterine wall. It presents with vaginal bleeding, abdominal pain, uterine contractions, and fetal distress. Placenta previa is painless bleeding, ectopic pregnancy is early gestation, normal labor is at term. Abruption is an obstetrical emergency requiring immediate delivery. Management includes 4 fluids, blood products, and urgent delivery. Question 12. A patient with a long bone fracture presents with severe pain out of proportion to the injury, swelling, and pallor. The patient has a cast. Which diagnosis should the CEN suspect? Option A, compartment syndrome. Option B, fat embolism. Option C, osteomyelitis. Option D, DVT. The correct answer is option A, compartment syndrome. Compartment syndrome is a surgical emergency characterized by pain out of proportion to the injury, pallor, pulselessness, paresthesia, and paralysis. The 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. It occurs when pressure within the compartment exceeds perfusion pressure, leading to ischemia and necrosis. Immediate fasciotomy is required to prevent irreversible damage. Question 13. Which imaging study is preferred for stroke evaluation within the first 24 hours? Option A, CT angiography, CTA. Option B, MRI with diffusion-weighted imaging, DWI. Option C, CT perfusion, CTP. Option D, all of the above depending on the clinical scenario. The correct answer is option D, all of the above depending on the clinical scenario. Stroke evaluation may include non-contrast CT to rule out hemorrhage, CTA to assess large vessel occlusion, CT perfusion to assess penumbra, and MRI DWI for early infarction detection. The choice depends on the clinical scenario, time since last known well, and availability. For thrombectomy candidates, CTA is essential to assess vessel patency. Question 14. A patient with suspected tuberculosis should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C, airborne precautions. Tuberculosis is transmitted via airborne particles, droplet nuclei. Patients with suspected TB should be placed in an airborne infection isolation room, AIIR, with negative pressure. Staff should wear an N95 respirator or a powered air purifying respirator, PAPR. Contact and droplet precautions are for other types of infections. The patient should wear a mask during transport. Question 15. A patient with alcohol withdrawal presents with tremors, hypertension, tachycardia, and diaphoresis. The CEN should anticipate. Option A, benzodiazepines, lorazepam, chlordiazepoxide. Option B, antipsychotics. Option C, beta blockers. Option D, 4 fluids only. The correct answer is option A, benzodiazepines, lorazepam, chlordiazepoxide. Benzodiazepines are the first-line treatment for alcohol withdrawal, reducing the risk of seizures and delirium tremens, DTs. They work by augmenting GABA, thus preventing sympathetic overdrive. Chlordiazepoxide, Librium, and lorazepam, Ativan, are commonly used. DTs are a medical emergency requiring ICU-level care. Antipsychotics and beta blockers are adjuncts or alternatives but not first-line. Question 16. A patient with status epilepticus has received lorazepam 4 mg for without cessation of seizure activity. The CEN should anticipate which next medication? Option A, phenytoin 20 mg/kg4. Option B propofol 20 mg/kg4. Option C valproic acid 20 mg/kg4. Option D levetiracetam, Keppra, 1 gram 4. The correct answer is option A. Phenytoin 20 mg/kg4. After benzodiazepines, lorazepam, second-line agents include phenytoin, 20 mg/kg4, or fosphenytoin. Levetiracetam and valproic acid are also options but may be considered after phenytoin. Propofol is used for refractory status epilepticus. Airway management is critical, the patient may require intubation. Question 17. A patient presents with a sudden onset of fever, chills, and hypotension. The patient is a chemotherapy patient and has a central line. The CEN should suspect. Option A sepsis, bacteremia. Option B febrile neutropenia. Option C anaphylaxis. Option D pulmonary embolism. The correct answer is option B. Febrile neutropenia. Patients with chemotherapy-induced neutropenia are at high risk for infection and sepsis. A single temperature 38.3 degrees Celsius, or 38 degrees Celsius for more than 1 hour, is an emergency. Cultures, blood, urine, sputum, should be obtained, and broad-spectrum antibiotics should be given promptly. The patient is at high risk for bacteremia and septic shock. This is a medical emergency. Question 18. A patient with acute cholecystitis presents with right upper quadrant pain, nausea, vomiting, and fever. Murphy's sign is positive. Which diagnostic test is preferred? Option A abdominal ultrasound. Option B CT scan. Option C HITA scan. Option D X-ray. The correct answer is option A. Abdominal ultrasound. Ultrasound is the diagnostic test of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. Murphy's sign, pain on deep inspiration while palpating the right upper quadrant, is a classic finding. Treatment involves NPO status, 4 fluids, antibiotics, broad spectrum, and cholecystectomy. CT may be used if complications are suspected. Question 19. A patient with a suspected hemorrhagic fever, e.g., Ebola, should be managed with Option A strict contact and droplet precautions. Option B airborne precautions. Option C standard precautions. Option D enhanced contact and droplet precautions. The correct answer is option D. Enhanced contact and droplet precautions. Hemorrhagic fevers, Ebola, Marburg, Lassa, require a high level of isolation, enhanced contact and droplet precautions, including double gloves, impermeable gowns, face shields, and shoe covers. These patients should be in a single room with dedicated equipment. The CEN should follow the facility's protocol for high-consequence infectious diseases. Airborne precautions may also be used in some settings. Question 20. A patient with a spinal cord injury at the C5 level is experiencing neurogenic shock. Which findings are consistent with this? Option A hypotension, bradycardia, and warm, dry skin. Option B hypertension, tachycardia, and cool, clammy skin. Option C hypotension, tachycardia, and warm, dry skin. Option D hypertension, bradycardia, and cool, clammy skin. The correct answer is option A. Hypotension, bradycardia, and warm, dry skin. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic tone. This causes hypotension, bradycardia, and warm, dry skin, vasodilation. This is in contrast to hypovolemic shock, cold, clammy, tachycardia, and cardiogenic shock. Treatment includes 4 fluids and vasopressors. Question 21. Which finding is most concerning in a patient with acute abdominal pain, suggesting peritonitis. Option A, rebound tenderness and guarding. Option B, nausea and vomiting. Option C, diarrhea. Option D, fever. The correct answer is option A. Rebound tenderness and guarding. Rebound tenderness, pain upon release of pressure, and guarding, involuntary muscle stiffness, are signs of peritonitis, indicating peritoneal irritation. These are surgical red flags. Nausea, vomiting, diarrhea, and fever are nonspecific and can be seen with many abdominal conditions. CT imaging can help confirm the diagnosis: appendicitis, diverticulitis, perforation, or bowel obstruction. Question 22. A patient presents with suspected abuse, elder abuse or child abuse. The CEN should: Option A, report the suspected abuse to the appropriate agency. Option B, confront the suspected abuser. Option C, keep the information confidential. Option D, delay reporting until the patient is discharged. The correct answer is option A. Report the suspected abuse to the appropriate agency. Suspected abuse, elder abuse, child abuse, domestic violence, or human trafficking, is mandatory reporting in all 50 states. The CEN should report to the appropriate agency, CPS, APS, or law enforcement. The CEN should not confront the abuser. This is the role of the social worker or law enforcement. Confidentiality does not apply in cases of suspected abuse. Question 23. A patient with a chemical burn to the skin should have the skin: Option A, neutralized with an acid or base. Option B, decontaminated with water. Option C, covered with a sterile dressing. Option D, treated with a topical antibiotic. The correct answer is option B. Decontaminated with water. Chemical burns require immediate decontamination with water, irrigation, for at least 15 to 20 minutes. Neutralization is not recommended because it can cause exothermic reactions, heat, or further tissue damage. The CEN should remove contaminated clothing and irrigate the skin thoroughly. This may be done before the patient arrives in the ED, pre-hospital. Question 24. A patient with testicular pain, nausea, and vomiting has a tender, swollen testicle that is elevated. Which diagnosis is most likely? Option A, epididymitis. Option B, testicular torsion. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Testicular torsion. Testicular torsion is a time-critical emergency requiring prompt surgical intervention to salvage the testicle. It presents with sudden, severe testicular pain, nausea, vomiting, and an elevated, tender testicle. Doppler ultrasound is the diagnostic test, though surgery may be indicated without imaging if suspicion is high. Torsion is a surgical emergency. The window for salvage is typically 4 to 6 hours. Question 25. A patient presents with a snakebite on the hand. Which intervention is appropriate? Option A, apply a tourniquet. Option B, suction the wound. Option C, apply a splint and elevate the extremity. Option D, administer antivenom. The correct answer is option D. Administer antivenom. Antivenom is the definitive treatment for snake envenomation. A tourniquet and suction are not recommended, they can cause tissue damage. Splinting and elevation are supportive but are not the primary treatment. Antivenom must be given as soon as possible, with monitoring for anaphylaxis.